7, 6, 5. Okay. Good afternoon. My name is Dustin, and I'm here on the communications team at Children's Wisconsin. Each week, we've been taking time with some of our providers to talk about the ways that Children's continues to support and provide the best possible care for kids. Like everyone, we've had to adapt and change the way that we work and do our jobs in response to COVID-19. Today, I'm here with Dr. Christen McAlpine-Tesfai, one of our amazing pediatricians. She'll be answering some common questions about getting your child necessary vaccinations right now. And she'll be focusing on the importance and highlighting the ways that we've adopted the process to keep everyone as safe as possible. We will be taking questions. Feel free to leave them in a comment and we'll address them at the end of the video. So thank you so much for taking the time to chat with us today, Dr. Tesfai. Before we jump into the importance of vaccination specifically, can you help me remind families about how our primary care team continues to offer support today?
Hi, Dustin. Thank you so much for having me this afternoon. So during your interaction with children, it might be a little bit different than you're used to, but we're still here to help offer care for your child. You should know that all of our clinics are still open with their phone lines and they're always staffed. But we have consolidated our clinics regarding patient care on site. So as a result, we've expanded our virtual health offerings. So you should discuss this option with your doctor to see what might be available with them. And of course, we're still doing in-person appointments for those necessary visits, including vaccinations.
So tell me a little more about that. Why are we still doing vaccinations right now?
Well, Children's is prioritizing vaccines. It's more important than ever for parents to try to keep their kids on their vaccination schedule. Not vaccinating your child could potentially put your child at risk for contracting other dangerous illnesses. Now, prior to COVID-19, we are still seeing pertussis in the community. We're also seeing chickenpox, also known as whooping cough, and varicella. So these are preventable illnesses that we have vaccines for.
Can you tell me a little bit about what's changed with our process for providing vaccinations?
Yeah. So COVID-19 has changed a lot about what we've done to approach care, and vaccines are no exception. Patient, family, and staff safety is really paramount at this time. And we would never ask you to do anything that we feel would be unsafe for your child. So we're keeping newborn appointments, 0 to 2 month well baby visits in our office so that they can start and stay on their immunization schedule. Your clinic experience will largely be about the same, but providers and staff will be wearing PPE, which is also known as personal protective equipment. You'll also find other safety enhancements at the clinic when you arrive. Now, if your child is between the ages of 4 to 18 months old, we're now doing immunization only appointments. Remember, we've consolidated our locations, so it is possible that your child's immunization might happen at a different location from where you typically go.
So you mentioned that the location might change. How would a family know where to go in that instance?
Great question. So our clinic teams are reaching out to families either to confirm your appointment or to schedule an appointment. And at that time, they will let you know which clinic to go to.
Are there any visitor restrictions in place that parents should know about?
Yes, there are. We are limiting these appointments to just one parent or one caregiver and no siblings at this time.
Okay. How are we deciding which kids to schedule and reschedule vaccinations for?
So it's important to remember that we would never do anything that we don't feel would be safe for your child. So as we're working to ensure patients are getting their proper vaccines, we're looking at the information patient by patient. So if you're wondering why your child's appointment might have been rescheduled, or you're confused about what might have happened, please reach out to your provider via MyChart or by phone.
What if a family's unsure about which vaccination their child needs? What's the best way to get a hold of their pediatrician?
Well, you can always call our office. As mentioned before, although we've consolidated our operating locations, all of the phone lines at each clinic are still being staffed. If you have MyChart, that's another great option. So you can go online if you don't have it, and you can sign up for free. It is a direct line of communication, not only with your clinic, but also your provider.
We'll make sure after this that we leave a comment in the video description with a link to the MyChart landing page where you can sign up for free on that as well. Earlier, you talked a little bit about staff having appropriate PPE, including masks. What about patients?
So the CDC guidelines recommends that everybody wear a mask in public. So if you and your family have masks that you made at home or otherwise, we recommend that you bring that to your appointment. Now, if you don't have it, Children's is providing masks for the for the patient and the caregiver when they arrive.
And if you have your own mask, is that okay to wear and bring with you?
Yes, yes it is.
Can you tell me a little more about staff PPE and what's changed there?
Yes. So all of our staff will be wearing the personal protective equipment. Now, this will include masks, eyewear, and then potentially gowns and gloves. Now, it's important to let your child know about the PPE because it can be quite intimidating and scary for the child. We do suggest possibly showing a video or a couple photos of what this might look like so that your child's more comfortable when they come for their appointment.
Okay. On a more general scale, can you tell me a little bit about what is most concerning to you and your peers right now as we're going through COVID-19?
Yeah, so Dustin, our biggest concern is delay in care. We've found that there have been a few children with either broken bones who did not seek care for a couple of days. They ended up actually needing surgery. We've had some younger infants under the age of 2 months old who had a fever. Now, these kids should be seen right away, and some of them waited a day or two before seeking care, and they actually needed admission. So our biggest concern is keeping kids healthy and safe. So if you have a question or concern about your child and a potential illness, we want you to reach out to our clinic or after hours triage for further advice. Now, we do recommend that if their recommendation is coming to clinic, going to the ER, or going to urgent care, please bring your child in so that they can be evaluated so that care is not delayed.
Okay. Before we go into any potential questions, is there anything else that you want to highlight for families to know about Children's Wisconsin and what we're doing today?
Yes. So Children's would never ask you to bring your child into any situation that would be unsafe for them. We really want you to trust us. We're here for you. We're expanding our virtual health from provider-initiated video visits to online urgent care. We're here to get your child any kind of medical attention that they may need. And please don't be afraid to reach out to us if you have any questions or concerns. You can reach out again by MyChart or calling your clinic, and they can talk to you about any vaccine concerns you may have as well.
Great. Do we have any questions from online?
We have some general questions that you already hit on, but might want to talk about again. If a vaccination appointment was scheduled at one point, is there a reason why it might be canceled currently?
Did you hear that?
Yes, I did.
Okay.
So we have been rearranging schedules to make sure that we're able to bring patients in safely. Again, it's provider initiated, and so each provider is looking at their patient panel and deciding what child might need to be seen a little bit sooner. And if it's a vaccine that maybe could wait a little bit, that might have been why that patient got rescheduled. But again, if you have questions, please reach out to your clinic and your provider.
Yep, they're absolutely available to answer any questions you might have on that.
And just one more, if they are getting scheduled for a vaccination appointment, is there a chance they would be going to a different office that's not their usual office that they would be going to?
Yes, because we've consolidated our locations, there are some sites who are seeing in-person visits. There are other sites who will be doing vaccines. And so when you contact your clinic or if they call you to confirm that appointment, they should verify with you what location that would be at, because it might not be at your home pediatric site.
Okay. Well, thank you again so much, Dr. Tesfai. We really appreciate your time today. For anybody watching, if you have any questions about Children's Wisconsin and our response to COVID-19, we encourage you to visit chw.org/coronavirus for a detailed FAQ on things. And of course, you can always call your clinic or contact your primary care provider via MyChart. You can find all kinds of resources on that website, from details about our locations to many of the blog posts that we've posted with what the experience is like here at Children's right now. Remember, we're taking new steps with a focus on keeping our patients and staff healthy so we can continue to provide the best possible care during COVID-19. But we'll always be here to help and care for your child. That's never going to change. We'll be back next Tuesday with another live stream, this time with a team member from our emergency department. And again, cannot underscore this enough. Don't hesitate to call or reach out to your provider via MyChart if you have questions, whether it's about vaccination rescheduling or any other experience. We are here for you 24/7 and happy to answer the questions you have. Thank you so much for watching.
Thank you.